Welcome to PT Microlessons, fast lessons with big impact. In this lesson, we're going to look at common sex-specific genitourinary conditions relevant to PT practice. We can begin organizing GU conditions by first determining whether they present acutely or chronically. Acute conditions tend to have a sudden onset and more severe symptoms, while chronic conditions are usually more gradual and persistent. From there, we'll look at pain location and behavior, followed by key features and red flags. Also remember, some conditions are male or female specific, which can help narrow things down quickly. Overall, these factors help guide clinical reasoning and determine when referral is needed. Here are the common sex-specific GU conditions covered in this lesson. For males, this primarily includes prostate-related conditions. For females, we need to consider conditions such as pelvic inflammatory disease, ectopic pregnancy, endometriosis, and uterine fibroids. What's important to understand is that these often have distinct patterns and presentations, which help guide clinical reasoning and referral. Let's start with some male-specific conditions, starting with acute prostatitis. This is an acute bacterial infection of the prostate. Pain is typically felt in the perineal or pelvic region, and may also present as low back pain. Key features include dysuria, urinary frequency or urgency, and systemic symptoms like fever and chills. Because these are infections, these patients require urgent referral. The triad is perineal pain, urinary symptoms, and fever. In contrast, chronic prostatitis presents with persistent chronic symptoms, rather than the more severe acute presentation. Pain is again in the perineal or pelvic region, but without systemic signs. Key features include ongoing pelvic pain, urinary symptoms, and pain with sitting. Urinary symptoms could include hesitancy, starting stream, weak or intermittent flow, incomplete emptying sensation, post-void dribbling, or nocturia, which is the need to wake up one or more times per night to urinate. The triad is chronic pelvic pain, urinary symptoms, and pain with sitting. Let's take a look at benign prostatic hyperplasia, or BPH. This is an age-related enlargement of the prostate, commonly seen in older men, and presents as a chronic condition. What's important to understand is that symptoms are due to urethral compression, not inflammation. Patients typically report difficulty starting urination, a weak stream, and increased frequency, especially at night. A key feature to remember, pain and hematuria are not typical, which helps distinguish this from other conditions. The triad is painless urinary hesitancy, weak stream, and nocturia. Okay, next let's look at prostate cancer. This is typically a chronic, slow-growing condition and is often asymptomatic early on. When symptoms are present, they are usually urinary in nature, such as hesitancy, weak stream, or incomplete emptying. Pain is not usually a primary feature early, but may occur later in the pelvis or low back. These patients require referral for medical evaluation. The triad is urinary hesitancy, weak stream, and incomplete emptying. Now we will transition to cover the female-specific conditions, starting with pelvic inflammatory disease. Pelvic inflammatory disease is an acute infection of the female reproductive organs. Pain is typically in the lower abdomen or pelvic region. Key features include pelvic pain, fever, abnormal discharge, and dysmenorrhea, and patients may also report pain with intercourse. It is more common in those with a history of sexually transmitted infections. These cases require urgent referral due to the risk of complications. The triad is acute pelvic pain, fever, and vaginal discharge. Next, let's look at ectopic pregnancy. This occurs when a fertilized egg implants outside the uterus, most commonly in the fallopian tube. Pain is typically in the lower abdomen or pelvic region and may be one-sided. Key features beyond pelvic pain include a missed period and vaginal bleeding. Patients will also have a positive pregnancy test, which helps confirm pregnancy but does not distinguish ectopic from a normal intrauterine pregnancy. Overall, what matters clinically is that this requires urgent referral for immediate medical evaluation. However, it can become a medical emergency if rupture occurs, leading to hemorrhagic instability. Signs of instability include tachycardia, hypotension, pallor, and diaphoresis, which require activation of emergency medical services. The triad is amenorrhea, vaginal bleeding, and pelvic pain. Now, let's look at two chronic conditions, starting with uterine fibroids. These are non-cancerous growths in the uterus and present as a chronic condition. Pain is typically felt in the pelvic region, often described as pressure. Key features include heavy menstrual bleeding, prolonged menstruation, and pelvic pressure, and they may also be associated with infertility or pregnancy complications. These cases require referral. The triad is pelvic pressure, menorrhagia, and prolonged menstruation. Now, the other chronic condition we will cover is endometriosis. Endometriosis is a chronic condition where endometrial tissue is present outside the uterus. Pain is typically in the lower abdomen or pelvic region. What's important to understand is that symptoms are often cyclical, worsening with menstruation. Key features include dysmenorrhea, pelvic pain, and pain with intercourse, and it may also be associated with bowel movements if tissue involves the intestines or rectum. These cases require referral. The triad is cyclical pelvic pain, dysmenorrhea, and dyspareunia. Okay, let's summarize this. All of these conditions have key features that can often be simplified into a triad. Start with the location of pain to identify the likely organ or region. Then determine whether the condition is acute or chronic. From there, look at the key features, which may include urinary symptoms, bleeding or discharge, menstrual changes, or other reproductive symptoms. And finally, determine the level of urgency to guide referral and clinical decision-making.
That's it for this PT Microlesson. Like and follow at PT Microlessons for more fast lessons with big impact on physical therapy topics.